Hi, I'm Dr. Rob Jones at Utah Wellness Institute. Got a question for you. 3 things. What does depression, anxiety, overweight, and let's throw in a 4th, fatigue. What do those things all have in common? There's a common thread running through them all, and that is called thyroid. If your thyroid is low, will it cause depression and anxiety? Probably 100% of the time. Because if you're low energy all the time, is that depressing? Yes. As a matter of fact, we have a lot of women that come into our clinic and I'll see that they're on their paperwork that they filled out, they're taking an antidepressant. And I'll ask them, well, are you depressed? And they kind of pause and they look at me and say, well, I don't know. I said, well, you're taking an antidepressant, must mean you're depressed, right? And they said, well, I take that because my doctor ran a bunch of lab tests on me and they didn't find anything, so they gave me an antidepressant, said, see you next year. And I hear that so often and it's so frustrating, but say, well, let's see, are you tired all the time? Oh yeah, I can sometimes not even function. And you're overweight? Yes, I've got 35 pounds I need to lose. I said, well, okay, you're overweight and you're tired all the time. That's depressing. And they go, yes, that's depressing. I said, but that's not clinical depression. That's situational. You're frustrated and you're depressed about your weight and the fact that you can't keep up with your husband and your kids anymore. That can be a very serious thyroid issue. So you need to get it checked. And the way you get it checked is doing blood work. We've also done another one of these YouTube videos on how to check your temperature. Look that up. But one of the biggest things you can do is have your doctor or us check what's called your T3. Because most doctors, when they check your thyroid through your blood, they will only do a TSH. That stands for thyroid stimulating hormone. That's not going to tell them anything about your daily fatigue and your overweight. And that's the real issue there. So it's the T3 that you want to know about, not necessarily the TSH. Some women come in and say, you know, I had to argue with my doctor. He didn't want to run that test on me. He says TSH is sufficient. No, it's not. You won't know really anything about your thyroid until you get your T3 checked. We check about 5 different things regarding your thyroid because we want to make sure of what's causing the fatigue, the overweight, the anxiety, and the depression. Thanks, I'm Dr. Rob Jones at UtahWellnessInstitute.com.